before we officially start that this, in fact, the recording has started. So I just wanted to make sure everybody was aware of that. And the recording of the meeting is placed on our YouTube page. So we just need to remember and be mindful that it is a meeting in public in that sense, and it is available for on catch up for anyone, any member of the public actually who'd like to access it. So warm welcome to everybody to I think, well, the first Council of Governors meeting in the new financial year for us. So fantastic to have you all here. And particularly warm welcome to our new governors, many of whom we had the fortune to meet face to face on Tuesday. And I think it was a really good session, a good opportunity to meet several of our new governors. So warm welcome to you. We have had a couple of apologies from executive colleagues due to holidays. Angela Hillary, our Chief Executive, and Chris Oakes, our Director of HR and Organisational Development. Angela is ably covered by our Deputy Chief Exec, who is here today, David Mayer, and I'll introduce Dave later on. We've also had governor apologies from Kerry Bradshaw, Krishna Yathiraj and Laura Wood. But again, the really good thing about having our governor meetings recorded is that any governor who wasn't able to attend can catch up. And we are expecting Carol Phillips, who's the governor chair of our Nominations Remuneration Committee, but Carol is joining us a little bit later. So as I said, warm welcome to our new governors. I think it's probably because of the number of people in our meeting, much as it would be lovely to introduce everybody, I do think it's probably a little bit impractical. So just really, particularly for those people who've not had the opportunity to meet our new governors already, be great if you could just say who you are, if you happen to speak, or if you're introducing yourself in chat or anything else. It might be just quite a nice way for people to know who's in the room, but we'll certainly remind everybody to introduce themselves if they're asking a question. I do want to share a little bit of sad news. We did get notification that a former governor of ours who was a very long-standing member of our council and a valued contributor on our council sadly passed away, Kevin Boyce, who colleagues will know. And I really just wanted to say how much we will miss him and just record really our appreciation of the fantastic contribution he made to the council whilst he was a member. He did step down a while ago, but he completed I think something in the region of 3 terms of 3 years, if I'm right. So it was a very long stint that Kevin did for us. And I know his friends and his family will really miss him. So I felt it was important to share that with you. The second item on our agenda is declarations of interest. I'll take it that there is a paper on that, paper A. It records all the interest from every member of the council. New governors will be asked to return that form if you haven't already done so via your induction pack. And it's really important that you do that because that needs to be available to everybody to see whether you have any potential conflicts of interest. But you also have an opportunity if you think that there's something on the agenda today that may have a particular relevance to any other role that you have an opportunity to declare that specifically relating to the agenda. So that opportunity is now. So if anyone would like to declare an interest for anything on the agenda, then please do so now. Otherwise, I'll just take it that there isn't anything to record. So item number 3 on our agenda is minutes of the previous meeting, and that is paper B. Obviously, those people who weren't at that meeting aren't able to comment on this, but are there any matters of accuracy that anyone would like to raise? And if so, be grateful if you could either put a physical hand up, or if you know how to use it, there is a raise hand facility on Microsoft Teams. I'll take that as a no, as I don't see any obvious hands up. So we'll take it then that if everyone's content that the minutes are accurate, we will approve them for the purpose of today's meeting. There is an action log, that is paper C, and there are two outstanding actions. Action 61, which is the Code of Conduct forms. I think at the last count, we had 3 outstanding Code of Conduct forms that were due for return. Jo or Tracy, is there an update on that? Are we closer to having a full complement?
We've still got the 3 outstanding that we had before.
Okay, so we'll need to follow those up. I'll just remind everybody, because we refreshed the Code of Conduct, I think we agreed a new version back in March or January. I can't quite recall. Richard will no doubt correct me. But because we did agree a new Code of Conduct, we do need every governor to sign the new Code of Conduct. And obviously, again, for new governors, we'll be asking you to return that, and we'll follow that up with you to make sure you are supported to do that. So just a quick reminder that that is really important for everyone to do that. It is actually a breach of the Code of Conduct if you don't sign the Code of Conduct. So actually it is really important and not just an administrative task. Action 63, I don't think we have Councillor Golby with us today. What I was going to suggest is this was relating to sort of really I think the topic of conversation was about the well-being of carers in Northamptonshire and the importance of that being recognised as perhaps even on the Health and Wellbeing Board's agenda, as it previously was some years ago. As we've not been able to conclude that item, and I was conscious that I think we have coming up a new governors and members webinar for carers, which is taking place shortly, as I seem to recall. What's the date of that, Tracy?
6th of June.
6th of June. So what I was thinking might be a helpful alternative step is to invite the members of the Health and Wellbeing Boards of both councils to attend the Carer Governors webinar, because we could very easily send that invitation. Wouldn't that be a great way of sort of getting the Health and Wellbeing Board members engaged in the well-being of carers and the importance of the carer role, particularly in the context of mental health services. So I'm happy to take that action forward outside of the meeting, and perhaps we'll amend it to take it forward in that way. So that concludes all the general matters, standing items that we needed to cover at the start of the meeting. So we move on now to the constitutional matters which we need to cover today. And the first of which is the Director of Corporate Governance report. And on this, I'll hand over to Richard Smith. So Richard.
Thanks very much, Krishni, and good afternoon, everybody. I'm Richard, and I'm the Interim Director of Corporate Governance. I'm going to refer to paper D in your packs for this short update, and I'm not going to laboriously go through each of the items in this report, but we'll just focus on 3 areas this afternoon, the first of which is some changes we've had to governor membership. The second is just an update on where we've got to with our membership agenda, and the third then is to highlight the wellbeing protocol and the work that we're doing there. So firstly, really just to add to Krishna's earlier words of welcome, both to new governors that are joining us for the first time today, but also a welcome to Richard Amponsa in his new role, both as Deputy Lead Governor, but also as Interim Lead Governor following the departure of Chris Davison. And we're really pleased that we've managed to recruit to the vast majority of vacant posts on the Council of Governors in this elections campaign, and we shall be using the opportunity over the year through our membership programme to engage further with each of the membership constituencies before we then go out to election for the remaining vacant positions. So in relation to membership, I'll draw your attention to the second page of the report, in which we've set out the work we're doing on membership. And appended to the report are the draft terms of reference for our new membership engagement and representation committee, on which I'm seeking the council's approval this afternoon. And also attached are the proposed priorities for the coming year. I'm pleased to say that we've had some good engagement from governors through a survey that we sent out earlier on. So hopefully the things that we're proposing there to focus on resonate with people as the things that we need to focus on over the coming year. Just also to highlight, in that section, we've set out what we're proposing to do with the annual public and members meeting, the annual general meeting of the Council of Governors, which is coming up in September. Time flies. It seems like only a minute ago that we were doing the last one, but this is happening on Monday, the 18th of September from 5:30 in the evening via Microsoft Teams. And then finally, and I just wanted to draw out the reference in the report to the work that we've been doing on the wellbeing protocol. You'll note that we're now describing it as the wellbeing protocol as opposed to the welfare protocol. This was thanks to some helpful feedback that we had from governors who joined us in a series of workshops that we had looking at what we needed from this protocol into the future. So you'll see here that we're planning to do some further engagement on this protocol before we bring it back to the council for approval. So with that, Christine, I think I'll hand back to you, noting that I'm requesting really approval from the council to the proposed terms of reference and the member priorities which are appended to this report. Thank you.
Thank you very much, Richard. So we have an opportunity, colleagues, if you want to ask any questions about any aspect of that report, not just the items that Richard has covered. So if anybody would like to raise any points, I will just pause to see if there are any questions. Otherwise, we are really just being asked to approve the membership engagement and representation priorities that are outlined in that report, and which we actually talked through with new governors at their induction, which hopefully made sense for people, and indeed also approve the committee terms of reference, and that will be a really important opportunity for governors to engage in more of our membership and engagement work. So I'll pause there, but I can't see that anyone's got any comments or questions. So can I take it that everyone's happy to support the approval of those two items? I think those are the only items you specifically needed approval for, didn't you, Richard, in order to be able to publish those and certainly take forward the terms of reference. So if anyone's got any objections, please feel free to say so. You have an opportunity to do that. If not, I'm not going to ask for a show of hands, but I'll take it that everyone's happy to support approval unless there are any objections. Great. Okay, and feel free to use the chat box, but obviously I will try and read out if there's anything there that needs to be commented on. So thank you very much. I do also want to congratulate Richard Amponza. So of course, many of the new governors met Richard on Tuesday. Richard, as people know, is one of our staff governors, and Richard was elected as our deputy lead governor, as the report highlighted. But in the absence of Chris, who stepped down as lead governor, because actually we felt it was really important to give all the new governors actually a chance to stand for lead governor in the future. We've obviously, in his capacity as deputy, we've asked him to be the interim lead governor for a period of time. So thank you very much, Richard, for stepping into the breach and supporting the council in that way. And I'm sure you'll all be very happy to support Richard in his role. Okay, well, thank you very much. So we've dealt with that. So we are now moving on to item 6. And actually, this is actually an opportunity for the Council of Governors collectively to hear about life on the ground from a governor. In the previous meetings, we invited our staff governors to share a bit of their experience. And as we've pretty much covered all our staff governors over the last few meetings, we've started to invite our partner governors who represent a number of different partners within who work with us. And today we're really delighted that Sharon Wormersley, who is the Chief Executive of Lowdown, to talk about her life as a partner governor. I think I've introduced you correctly, haven't I, Sharon?
Just about.
Thank you, Sharon. Over to you.
Okay. So I'm just going to share a presentation. So I am Sharon Wormersley. I'm the CEO of the Lowdown, but we are part of a Reach partnership across Northamptonshire, which is made up of 5 agencies. So Service 6 in Wellingborough, the Lowdown in Northampton, Time to Talk in Daventry, Chat in the Oundle area, Youth Works in Kettering and Corby as well. So we cover with all of the services we offer the whole of the Northamptonshire County. So we have been commissioned by the ICB and NHFT to provide support services for 5 to 25-year-olds. We also have other services that our charities offer that are supported by other funders, but we will concentrate on what is supported through the ICB in this particular presentation. So our core purpose as a collaborative is to provide services for children and young people. All the services that we provide are free, and we want young people to have timely access to evidence-based early intervention services that improve their mental health and emotional well-being and resilience. So those are really the focus. Any services that we're offering are related to young people's mental health and well-being. So, as I said previously, we work all the way across Northamptonshire, and those are the where the agencies are working. And the Lowdown is obviously working in Northampton. And we get our referrals from a variety of sources to our agencies. So we have the NHS Referral Management Centre, where professionals can put forward for referrals for our services. But we also have self-referrals. So any young person can self-refer to our services if they need them, or their families, or their teachers, or whatever, as long as the young person is wanting to receive our services. So that leaves our services very open access. They are based in the communities where we're working, so there is it is not a medical setting that our services are run in. So, as it said, the young people must be aware that the referral is coming in, and for young people under the age of 13, parental consent is required. All our services are confidential, so a young person can share whatever it is that they want to share with us, except if there is a safeguarding concern, obviously. And if there is one, then we do that in collaboration with the young person, if at all possible, to make sure that we keep our young people safe. So we work closely in collaboration with our colleagues in NHFT. There is thresholds that young people are supported at. So the Reach collaboration is working at tier 1, 2 and 3, and NHFT is working at tier 4 and 5. So obviously the very high end of mental health needs is supported by NHFT and CAMHS, but we were lucky last year to be able to start to develop some support which actually bridges CAMHS. We often hear the phrase that they don't meet the criteria, and that was recognised by NHFT, that young people who don't meet the criteria but still need some support. There was a new project that was introduced with regards to tier 3 young people to make sure that they get the support that they need as well. So we offer a number of different services, but we're supporting young people with any issue that it is that they want to bring to any sessions that they have with us. And they include self-esteem and confidence, relationship and family problems are the highest cause, if you like, of young people coming into our services. And we do see that as a key area for us. But worryingly, over the last 3 years from the pandemic, there has been a significant increase in self-harm and suicidal thoughts that young people are experiencing. So there is a lot of safeguarding around that. And there's also a lot of social isolation and loneliness that our young people are experiencing as well, more so because of the pandemic. So we have various services that are commissioned by the ICB, 3 different counselling services. So one counselling service that supports the emotional wellbeing at tier 2, a counselling service at tier 3, so higher level need, that we have qualified and experienced counsellors that are supporting those young people, and they can be offered more sessions as part of that contract, so they have up to 12 sessions. And then rapid response is also a counselling contract, and that is about a young person who has had a serious self-harm incident or a suicide attempt that needs immediate access to support. Then we can escalate those young people to receive support immediately. They're not always ready for it, but some are. But we can support those young people as soon as the need is identified. We have a Happier Families programme, which has been running for a few years now, and is supporting families and so the young people and their parents or carers as to how they can work better together. And that is based on the 10 keys for happier living. So it's a low level, low threat intervention, but when the families have been through that programme, that has had significant impact. Then we have the Wellbeing Cafes, which we launched in January 2020, and they are open access cafes for young people aged 11 to 18 across the county, and we'll come on to the timings of those, but they're drop-in sessions, so a young person wherever they live in the county can access those cafes whenever they want to receive emotional wellbeing support. And then we have also LGBTQ out there groups. So we have them in Corby, Kettering, Northampton, Wellingborough and Daventry, and we're also going to be able to expand that service again to 2 more rural locations as well. So whatever we do, we're trying to make sure that we have county coverage for all of the services that we offer, so that young people have equal access to the support they need. Also, last year we launched a Restart service, which is supporting young people that are transitioning from child and adolescent mental health services to adult mental health services, and any practical support that they might need within that to access any service that they need. There has been an awful lot of homelessness, financial issues as part of that, but also making sure that the young person can access their mental health needs. And then our partner agency, Service 6, has been running the Happy Heads programme, which is support for under 11s in schools, working in partnership with the mental health support teams in schools to make sure that we're not duplicating any services to provide support for under 11s as well. So quite a wide range of services. We started, I joined the Lowdown about 4 years ago, and at that time we had the rapid response, the lower level counselling support, and one LGBTQ group, and all of the rest has developed during the pandemic. So it's been quite challenging, but it is really good news for the young people of Northamptonshire. So as Reach, just for our counselling service, not including rapid response, we provided 23,000 counselling sessions last year. So we've really seen an increase in the demand for our services and an increase in how many sessions we provide and the number of referrals that are coming into the agency. So they're quite significant numbers, and we have seen that young people have really been struggling during the pandemic, and have done our very best to support them as well as we can. So just going through some of the services. So the Happier Families programme, as I said previously, is about working to build happier relationships within a family environment, and so that people can enjoy their family time together, and how they can support one another to be happier in their lives. And that is quite important, because that's one of the only family interventions that we offer for young people and their families. We do have the cafes that we can provide parent support in as well, but this is what we have to offer families. So the Wellbeing Cafes, they are across the county. So in Northampton, Corby, Kettering, Wellingborough, Raunds was just launched, and Towcester were just launched over the winter pressure period, Daventry, etc. So we really have good coverage of the county Monday to Saturday, and they can provide immediate access for support, and also support with accessing other services that they might need for their mental health and well-being. And what we've found is that does increase the accessibility to other services. So we have young people that come and build their trust with an organisation in the cafes before they're ready to step up to counselling support. They need to make sure that they're speaking to people that they can trust, and that is a way of making sure that we improve the accessibility to our services, as well as it being a standalone support provider for young people that don't need counselling services. We then have our LGBTQ support services. So they've varied the different age ranges that we support across the county, but there is support in all of those locations. We also have a Parent and Carers Facebook group to support the parents of young LGBTQ people, and also a meetup every third Thursday of the month as well. So whatever we're doing, we're trying to make sure that it is cross-county and consistent. And as I said, we're looking to expand that by another two groups, locations to be defined. Then we have the Restart service, so supporting young people transitioning between child and adult mental health services, and making sure that young people don't fall through the gaps and can get the right level of support that they need to provide to help them have a happier life as well. That is relatively in its infancy. It's been running for about a year now, but we've had, as you might imagine, no problem getting the number of referrals that were planned into that service. Young people can access that service for as long or as short a time as they want, and they can re-access the service if they have been into it before and find that before their 25th birthday they need further support. It is available to them. So that's a fantastic service in providing the needs of the young person individually, and the level of support that they require. So it is about meeting with the young person, understanding what their needs are and how we can best support them to obtain those outcomes. We then have the under 11s support services, which is run in schools. This contract has been extended for another year, and I think that we're recognising that younger age groups also need support. So for the cafes, for example, from September, we will reduce the age range to 10. Because we see that even younger people are young people are struggling with their mental health as well. So this service helps support young people that are transitioning from primary to secondary, helps with safeguarding, helps with onward referrals, and also equips them with ways to manage their emotional well-being as well. There are various ways to refer into our services, so through the referral management centre for professionals, and then also directly with our agencies. So all of the agencies take self-referrals for any of our services. And any young person can drop in or phone if they need support, and that does happen on a regular occasion as well, to make sure that our services are as accessible as possible. And that is that. So I know that was probably quite a whistle-stop tour through our services. Can you still hear me? Yeah. So are there any questions from anything that I've talked about?
Thank you so much, Sharon. Really insightful. I'm conscious that actually I sort of saw some of that before and thought how impressive it was when you delivered it through the webinar I think we did together with CAMS services about children's mental health, and I think we did that a few months ago, and that was really, really, really good to see again how clearly you were sort of working with the NHS services, and as I think Robin said, you know, that the join up with the voluntary sector and really trying to work in partnership is so key. Perhaps just, you know, what might be just interesting is how it feels like for you doing the job that you do. Would be just quite interesting to hear a sort of personal perspective, but there are people putting some hands up, so maybe I could bring you back in on that in a moment, but let me just so Joanne first, please. Joanne Dalrymple-Smith.
Hi, I'm Sharon. As you know, I'm the staff governor, and I really enjoyed listening to the webinar that you presented. Just want to come back to Tier 5, because I think at the webinar, when I listened to it for Tier 5, thought the response rate was quite long, and I seem to pick up today as have things improved with the response rate for children who are, you know, really in a very difficult place.
I can't answer that question, to be perfectly honest, Joanne, because we don't tend to see a Tier 5 level. We might see people bordering between Tier 3 and 4 and be helping them to transition to CAMS services if needed, but I don't want to answer something when I don't actually know the answer, to be fair.
Okay,
sorry.
thank you.
Thank you, Joanne. I think yeah, it was probably because it was a joined up presentation with Sharon, and I think Sharon Robson and some of the CAMS team were involved, weren't they, in that webinar, if I remember? So they're probably in a better position to answer where we are in terms of waiting times for some of the more acute services. But obviously, I don't know if any of you caught the news yesterday. I think that one of the big top news items was actually about access of young people to children's mental health services, and I think what this is a really great example of actually kind of providing that support, you know, for people who actually perhaps don't meet the threshold for the more acute services, and working in partnership has certainly been key in that respect. Scott?
Yeah, thank you, Krishni. So hi Sharon, good afternoon. My name's Scott Adams. I'm one of the non-executives at the Trust. Sharon, I'm usually quite an avid user of chat just to make my comments as we go through here, but I don't really think I'm going to say anything that hasn't been said in the chat. But I just wanted to acknowledge the fact that, first of all, an incredibly impressive presentation and extremely well presented by yourself. I took a lot of encouragement from, gosh, so many dimensions of what you've just spoken about, really the breadth of the services, just the range in terms of the geographic coverage, you know, all of the age ranges that are covered. And I just thought it was an absolutely fantastic example of sort of joined up services, you know, right across the county, and the way that we're supporting each other, you know, on a partnership basis. So, you know, normally I would put a comment like that in the chat, like many others have, but I just felt as if it was a little bit of an underwhelming response to such a good presentation, Sharon. So I felt as if I should speak up. So thank you for everything you just covered with us.
Thank you.
Thank you, Scott. Robin?
Yeah, hi Sharon, good to see you as ever. I think I will just declare some sort of interest. I think I was on the board of No Down about 30 years ago, but I can't even remember now. But yeah, what this illustrates is the progress over time, because 30 years ago this would not have happened. The kind of links between voluntary organisations in a kind of systematic way with the statutory sector as represented by HFT just would not have happened 30 years ago. And now we've reached a point of maturity when there is real recognition of the complementary value and linkage of services in this way, because some young people will much prefer and access voluntary sector services in a way that they would not feel as comfortable accessing statutory ones, which is no critique of the statutory ones. So I think this is a really good illustration of progress over time. So thank you again, Chair.
Thank you.
Thank you very much. Just check who else. Dave Mayer.
Thanks, Krishna, and hello, Sharon. Really nice to meet you. I'm Dave Mayer. I'm the Managing Director and Deputy Chief Executive covering for Angela. Really great presentation. I've heard so much about the REACH Collaborative. You really brought it to life for me, even though I've been in the trust 2 years. I just thought it was a great example of social value, which is something we've been discussing as a partnership and as a group with our Leicester colleagues. And as Robin says, that kind of model of working with the voluntary sector, which you know, that third way of kind of bringing voluntary and statutory sector organisations together, I think it really is the framework that's going to carry us through the next few years and austere times ahead of us. So thank you. I just wanted to express my thanks for bringing that to life for us, and perhaps giving inspiration for other services to think about how they might bring some of what they do out into a community orientated framework like you've described with the REACH Collaborative. So well done.
Thank you.
Thank you very much, Dave. And not that executive directors think alike, but David had made a very similar comment in the chat about actually the importance of this in relation to social value. I mean, I think, you know, and we've touched on this before, but, you know, we need to collectively view the voluntary sector and potential partners around our patch as assets within the community that we need to build relationships with. And I think, you know, the work of the Mental Health Collaborative, which is also addressing some of the adult mental health areas, is all about also working with you know, voluntary sector partners and viewing the voluntary sector as a sort of key asset in that, because I think the future it's absolutely critical, actually, and particularly if we're going to address more of the prevention agenda. So it's a great example, and I did omit to say, in fact, that Sharon isn't the first partner governor we have. We did have Mark Major presenting last time, and I suddenly remembered that, and I thought, well, how could I forget? Because I think we were equally passionate about Northamptonshire Carers that Mark represents, and the role that it plays, and the value that we get from our partnership. So, Joanne Lancaster.
Yeah, thanks ever so much. Thank you, Sharon. That was really interesting. So I'm a relatively new appointment. I'm Associate Non-Exec Director. A question really, Sharon, just in terms of, because it's obviously a really great geographic spread of activity. Is the network within the school environment equally spread across Northamptonshire in the same degree? Because obviously there's academies trusts that have maybe slightly different geographies.
So in terms of the way that Reach deliver the services, any of the schools, any school in Northamptonshire can refer into us for support. Yeah. Different Reach partners deliver their services in different ways. So, for example, the Lowdown provides it in the community, whereas Service 6 do provide it in the schools. We do have all of us, though, and this is one of the benefits of having had a pandemic, is that all schools can be supported with remote counselling for children and young people that find it difficult to get to our locations as well. So everybody has equal access whatever schools they're in, and then some schools also have the mental health support teams in schools providing additional support as well at an earlier intervention level.
Okay, that's helpful. Thank you very much.
Thank you, Sharon. Do you want to say just a little bit of a comment about kind of the day in the life of Sharon Wormsley? Would that be?
No, I will. So a day in the life of me is very challenging and very rewarding at the same time. So as Reach, we have gone on, and as each individual partner, we've gone on quite a journey over the last few years. I don't come from this sector at all. I was working in heavy engineering, so I've had an extremely steep learning curve, but I had an interest in mental health and supporting young people's mental health. And what I love about my role is that I am able to make decisions that affect young people's lives on a day-to-day basis. So once we recognise a need, we can adapt very, very quickly to that need, and that is what I love about it. We do have challenges. So the Lowdown in particular has run out of space to deliver its services. So we've got a major investment from government through the Youth Investment Fund to actually extend our building so that we can provide more services for young people as well and fit the services that we've already got in. So it's quite challenging, varied. I learn something new every single day, but it is really, really good to be part of the solution, and also that we are able to not offer just one service for a young person. There's lots of different services that we can offer to provide wraparound support too. And the final thing that I'd like to say, because there was a really, really good winter in terms of collaborative working. So when there was some additional end of year funding that became available, for the first time ever, everybody was able to talk about the priorities of that funding. So NHFT, the voluntary sector, as well as the council, to make sure that the funding went to the right place. And I think that is such a huge step forward, that firstly, that we've got our place at the table, but also that, we recognise we're not the only part of the solution, and that we can all work together to actually make better services for young people.
Thank you so much, Sharon. I think it's sort of an integrated care in action is this sort of, it just shows that there's some things, really strong foundations that we can build on, and learning, in the way that you described, and everything is evolving. And hopefully we can do that. We can kind of speed that up as well. Final comment then from you, Judith.
Thanks, Krishni. Thanks, Sharon, for your presentation. I'm one of the non-executive directors, one of a small group who are all here. My question is really, it's twofold. One is in relation to the number of young people that you are seeing through your different services. I presume they have increased. Do you have any sort of idea of what rate they're increasing at? And secondly, how has that impacted your funding? Because clearly, as a charity, it's difficult to get funding. You may get some funding nationally, but it must be a constant battle.
Funding is a constant battle, but I have to say that funding through the ICB has increased significantly over the last few years to meet the demand. So we haven't been in a position, fortunately, where we have young people that are on our waiting lists for too long for counselling, and the fact that, you know, we can offer immediate access to services is just incredibly takes the stress off me as a CEO, knowing that, you know, if a young person rings, there's something I can offer today. Just I can't respond for everybody, but I can say for the lowdown. So in terms of all of the support contacts we gave for young people last year, and a support contact can be is not just a phone call, it is a proper intervention with a young person lasting at least 45 minutes. Through the various services that we offer, there was over a 30% increase in the number of contacts. So we went from over 12,000 contacts to over 16,000 contacts in the last financial year. And we've increased from the number of people that we support from 2,100 to 2,365 as well. So it's huge numbers of young people. So just in Northampton alone, 2,365 young people have been supported by the lowdown. So that just gives you an idea of the scale of the young people that are needing support, and then that obviously goes across the rest of the county. And the lowdown in particular has seen the highest increases of the Reach Collaborative. So every year we're scratching around for the funding that we need to meet the need, but it has worked out, to be fair. We are listened to, and the funding has followed. Sustainability, of course, is always an issue, but I think that young people's mental health has come on the agenda far more than previously as well.
Brilliant. Sharon, thank you so much for telling your story and sort of sharing the experience on behalf of the Reach Collaborative, and also a bit of what it feels like to be you doing your role as well. And we really value your contribution to the council. And I think one of the, you know, as new governors heard, we also, many of you met Sue Watts on Tuesday, and Sue works for Age UK, and we'll no doubt hear from Sue at a future councillor governors meeting. But it's really quite useful, I think, when you've got a partner representative, a partner governor, that they're not really just sort of representing the organisation they work for, but the people that they work with. So in Sharon's case, we asked her to come on this because we felt actually it would also enhance the voice of children and young people onto the council, albeit, you know, Sharon is an employee of Lowdown and works within that collaborative. But obviously the role that the collaborative plays does really sort of give an insight into children and young people's experiences in terms of mental health. And Sue certainly said something similar about the importance of sort of representing the voice of older adults, you know, because of the work she did with Age UK. So I hope that's brought to life a bit of the role of a partner governor, albeit in a very specific context. And we'll absolutely be bringing more partner governors to talk to us through the next few sessions. Okay, I think we move on now to item 7. Hoping that you can still hear me. I do think I've got a slight freeze on my account.
We can indeed, Christy. So perhaps I'll take over from here then, in which case. So I'll draw people's attention to paper E in the pack, in which we've tried to bring together all of the work associated with our annual report and accounts. I'm not going to laboriously trawl through each of the slides here, but again, draw out some key points that are worth noting. For new governors in particular, rest assured you will get some further support from us in preparing for receiving the annual report and accounts as we head towards the annual meeting in September. So don't be bamboozled at this stage by some of the terminology contained within this document. I can see there are some slides on the screen. So let's move forward to the next one, please. Thank you. So as an NHS Foundation Trust, we have a helpful guide that's produced by NHS England as to what should be included in our annual report, and there's a similar guidance for our annual accounts. So you can see here some of the core content that we need to include, and actually there's quite a lot of detail underpinning each of these sections to make sure that we've included the correct information to enable us to be held to account by the public. We move forward to the next slide then, please. Thank you. So clearly governors have a key role to play here, not least in appointing the external auditors, but also then in receiving the annual report and accounts, which includes feedback from the auditors, and having the opportunity really then to hold to account. So asking questions about the report and the accounts, and providing some feedback in relation to the members that they represent on what the trust has done and is planning to do for the coming year. And this discussion happens at the annual meeting, which, as I mentioned earlier on in the meeting, is happening in September. So if we could move forward, thank you. Sorry, could we just go back a slide? Thank you. Yes, thank you. So on to the next one then, please. There's a slight delay on my screen here, apologies. So within the accountability reports, there are some core sections that we need to include, which, as I mentioned, are set out in the annual reporting manual. And here's just a snapshot of the sorts of things that are included. And this is, as the picture suggests, really, to enable us to be held to account for how we're using public funds to deliver healthcare services locally in Northamptonshire. So if we could move on to the next slide, please. So what we wanted to do this afternoon was to just share some of the things that we'd drawn out from the work of the council over the last year that we're intending to highlight in this year's annual report and accounts, really to test for resonance and equally to elicit any feedback from governors or from board members, for that matter, on things that we should be including. So you can see here some bullet points and some explanatory text. So you'll see that under the membership stream of work for the council, that we've clearly transitioned to a new membership database. As I think Krishni mentioned earlier, Sharon was one of the people that supported us in delivering one of our member webinars, which have proven to be reasonably successful over the past year and will be continued even into this year. We've continued our member bulletins. These go out in electronic format and in hard copy format. We have run a successful election campaign, as we mentioned earlier on, with a number of new governors joining us today. So if we move on to the next slide, please. Thank you. In terms of the Council of Governors itself, earlier in the year, the Council, in response to an effectiveness review, took the opportunity to strengthen its governance arrangements. So we made a number of tweaks to our constitution and supporting documents to align with how we're looking to work in this next period. So this means we've made some changes to the Council of Governors meetings, and indeed we had, I think, the first of our new Council of Governors workshop programmes earlier on today, where we considered our role as an anchor institution and social value, which was a really useful session, at least from my perspective. So we've done quite a bit of work to enhance the way in which we support governors to fulfil their duties and to be connected with the organisation. I mentioned in the earlier report the work that we've been doing on the wellbeing protocol. That's just one of a number of elements that we're introducing now into this year, following work last year. And we've continued to engage with our colleagues at Kettering General Hospital through a series of workshops on the integrated care system. And we've enjoyed some external speakers and really an opportunity to get to grips with some of the core topics that we're working on together across the Northamptonshire health and care economy. Next slide, please. So as we look forward, we've then made a number of changes to the council that we'll be continuing to implement in the coming year. So in my earlier report, I mentioned that we've been holding some vacant posts. You'll see at the bottom of this slide the rationale, at least for a couple of those, as we're partway through making some changes to our staff constituency. So we've held over those vacancies, which will then enable us to transition to the new staff constituency in the 2024 elections. And as I mentioned on an earlier slide, we've tried to align the council more closely to the size and shape of the Northamptonshire population as it stands at the moment. Next slide, please. So in terms of the Nominations and Remuneration Committee, here are some of the headlines, again, from last year that we've drawn out. So in addition to reviewing the procedure, we've successfully recruited a new batch of non-executive directors, many of whom have joined us this afternoon, and we've undertaken another annual appraisals programme. Next slide, please. I've already talked about this one, so I won't dwell here, but again, just to highlight that the annual public and members meeting, annual general meeting, is scheduled for the 18th of September at 5:30 in the evening. Next slide, please. And so as part of the annual report and accounts, we need to make a number of declarations in terms of our compliance with the provider licence and the code of governance. These are the details of those declarations that we need to make, and we're focusing in particular this afternoon on the final one there, which is around training and guidance for governance. So if we could go to, I think, the final slide. So based on the work that we've been doing over the last year, we're proposing that we have provided sufficient training and guidance for governors for you as a council to carry out your role effectively. And here are some of the things that we've offered and will continue to offer this year in support of that statement. So that's a snapshot really of where we've got to in compiling the annual report and accounts, or at least the annual reporting aspects for this year. I'd happily take any comments or feedback from governors or from board members, particularly if there's anything that we've missed there that you think really ought to be included to reflect the work of the council over the past year. Thanks, Christy.
Thank you very much, Richard. Just waiting for my screen to come back up. So Julia, over to you.
Thanks, Krishni. Hello, everybody. I'm Julia Curtis, and I'm one of the non-execs, and I chair the Quality and Safety Committee. It's not about the formal accounts. It's just to say that alongside this annual report and accounts, just for completeness, we also are mandated or legislated to produce a quality account of a similar nature, and that goes through our Quality and Safety Committee. And we've just seen the first draft of that, which was excellent, and a great summary of all the really important quality priorities that we're working on across the organisation in all the different communities we work in. And so when we talked at the committee about having sort of a bit of more of a summary, easy read version that people could perhaps take some key points from as great sort of selling points, because it's also a very open and honest document that talks about where we've learned when things go wrong. So really, really important information in it. So once that's more sort of finalised, then I think that will be a great read for yourselves as governors, or the longer version if you'd like. But just for completeness, that sits alongside this. Thanks.
Thank you very much, Julia. Are there any other questions that people would like to ask or comment on the content? No? Okay. So I'm assuming you can hear me. Unfortunately, I do seem to be having slight technical problems today. I suggest we go to a short break. I think we have time for a break. So if we take 10 minutes and reconvene at 4:10. But welcome back. We're going to start really with our next session, which is all about strategy and assurance. So there's a couple of different items that we're going to cover. First and foremost, there were some paper F and G, that were included in your pack. These are the standard chair and chief executive reports that are reported to board, but and they are there obviously for you to query anything that you'd like to as part of it. But particularly for new colleagues who are joining for the first time today, just to say what we normally do here is sort of both chair and chief executive take the opportunity to provide any updates or comment on things that are sort of top of the list, if you like, on top of the agenda at the moment, considering that the time that's obviously moved on since the original report was published. So I have a brief couple of points that I'll mention as Trust Chair that refers to my chair's report before I hand over to Dave for a bit more of a look at what's on his agenda at the moment. So a couple of quick things. One is to say really positive development that I reported in my last report was that the Integrated Care Board, which we've mentioned a couple of times here, has invited non-executive colleagues who are part of our organisation to join the committees, and a number of colleagues who are here today have had the opportunity now to do that. So it's actually happening. I reported that it would be, but it's actually beginning to happen. And I think people are reporting that it's very welcome and helpful. So I thought it was important to share that with governors. Also to mention that the non-executive directors' appraisals are all scheduled, and for those colleagues who took the opportunity to provide feedback, I know several governors did take that opportunity to provide feedback to the non-executive director appraisals. So just thank you very much, and I think I'm sure that's been very welcome and very useful way of sort of reflecting on what we can do better. And then finally, just to mention a couple of our new non-executive directors are here who've recently joined. So Tim Harrison, Joe Lancaster, and Robin, who joined earlier in the year. And really pleased to say everyone's now attended the NHS Providers Induction course, which is a really good NED, non-executive director induction course that we arrange for everybody. So a quick few updates from me. And I'll hand over now to Dave Mayer, who introduced himself earlier. And Dave is in the Chief Executive hot seat today. So over to you, Dave.
Thanks very much, Krishni. It is quite hot, I have to say, in my very small office. It's really nice to meet new governors. So hello to all of those who've joined. That's really fantastic. And particularly to hear, as I say, Sharon, from your experiences has been really, really stimulating and inspiring. So I guess top of my list, and I suppose all of looking at my colleagues on the call, is what's been a pretty fevered planning round. So for those of you not familiar to the planning process in the NHS, it normally starts with a set of guidance published normally around Christmas Eve, and then is intended to finish sometime by the end of March. We've been going full tilt at it up until this point. It still continues, really, particularly Richard Wheeler and other colleagues trying to square the financial position. I suppose positive news is that we have, through efforts of many of the exec team, ensured that the mental health investment standard is retained in Northamptonshire for the benefit of our population. That's not the case in other parts of the country who are also experiencing financial challenges. Some of the standards that are in place, such as the mental health investment standard, have been sacrificed to allow many ICBs to break even. We as an integrated care board and as a trust have put forward balanced plans. So we plan on breaking even with a set of efficiencies and value program initiatives behind those plans to help us get back onto a stable financial footing going into 23, 24, and indeed 24 and 25. And this is something that's common across all NHS organisations in terms of the financial challenges they face post-COVID. So just wanted to keep people appraised on that. We would be reporting through the Performance Committee with Judith in the chair on our developments in terms of how we're getting on with the value programme and ensuring our plan is met, and that will feed through to the board and ultimately to governors. Just an update on COVID. It'll be mixed feelings for people, I understand, but the WHO has stepped down the emergency status for COVID, and of course our thoughts are with those colleagues and family members who may have been lost to COVID. It doesn't diminish that sadness at all, but it does give us some hope for the future. Certainly as a trust, on the 3rd of May, our staff members came out of masks, and we will be using risk assessed masks going forward. So for example, if somebody on the ward is admitted or develops COVID on the ward, then we would risk assess that as requiring masks. But I just want to send enormous thanks to colleagues who have persevered for almost 3 years now, working in masks, and that is a real challenge. I think I'm hot in my office, sitting here comfortably, doing it in a mask and moving patients around. That's an enormous tribute to colleagues who've borne with that, and I send your thanks and our thanks to them for persevering. Don't know what the future holds. Positive indications over winter. We didn't see huge epidemiological spikes in either COVID or flu, indeed. So fingers crossed for the future that we may well be on our way out of this particular chapter in history. Some other good news. Last night you might have seen Bob Fletcher, who works in our liaison team in the Op Ally team, advertising the £150 million of mental health investment nationally, which is being spent on crisis intervention services, particularly mental health ambulances. And Bob showcased one of the new fleets. I think there's 3 in total being procured. I'm looking for positive feedback from Anne, but we are two in total. But that was really exciting to see Bob doing what he does best, which is promoting new service developments last night. So good news there. Further developments locally. We will hopefully in due course be seeing 2 community diagnostic centres opening up as part of our work in the integrated care system, one in Corby and one in Kings Heath. They will again open out a new spectrum of support at a community level for communities who are accessing diagnostic support, and be an adjunct to the mobile diagnostic units that have been in place across the county for, well, at least 2 or 3 years now. Some other developments, David Williams and colleagues in our strategy and partnerships team have successfully secured a place for NHFT and LPT on the Provider Collaborative Innovator Scheme. So that's a scheme involving 9 pace setting, I guess, trusts who are coming together to develop collaborations across mental health, learning disabilities, and across the spectrum of NHS services. So that's a great opportunity for us. We had a meeting, it feels like it was 2 weeks ago, but this week with partners, including NHS England, to work through what that might mean for us, what it could look like, but always with the patient in mind. So that improvement for outcomes being the driver for what we try to do when we integrate and collaborate with others. There's loads more I could cover. I guess I just want to call out just some of our chefs and porters have done amazing work, which is the porters are highlighted in the report, but equally 2 of our chefs have made it to the national NHS final and came second at Excel in London. So we're hugely privileged and honoured to have the quality of people working in the organisation, and to know that our patients are being fed so well, and the importance of food in recovery. I just think that's really inspiring, and inspiring for everyone to feel part of it. So well done to them. And then finally, just to call out our Linda has been working with the ICS, pulling together an ICS forum for nurses, midwives, and allied health professionals to support our work across the REACH network. That's really important and brilliant to have Linda's leadership in that space. And speaking of which, we also have our conference on Tuesday for nursing and allied health professionals, with a focus on 3 things, which I think I'll leave you with these as a parting gesture. The conference focuses on compassion for self, compassion for others, and compassion for the environment. And I think that is really also quite important and is part of our role as an anchor institution. So just want to say thanks to Julie and her team for pulling that together. It'll be a great event, I know. So happy to take any questions, Krishni, and I hope that's given people a flavour of kind of the things that we're working on and worries and concerns that we've got.
Thank you very much, Dave. That's it's a really interesting range of things that you've kindly updated us on. Julie wants to come in. Julie, can you introduce yourself? As obviously we've got quite a few new governors who won't know you.
Thank you, Krishni. Hi, I'm Julie Shepherd, the Chief Nurse for the organisation, and I don't like to correct Dave, but actually the Nursing AHP conference is on Monday. That's all
Monday.
I wanted to say. Sorry, because I know some of you are attending, and I know Krishna, you're closing for us, aren't you?
I
So,
am
thank you.
indeed, yes. Yeah, thank you, Julie. And it's probably worth mentioning, actually, Julie did extend an invitation to governors, and I think we let governors know about that a while ago. But I'm just wondering if there are new governors who wanted to attend, whether we can, whether it's still possible, Julie, or has the opportunity passed, do we think?
Well, if people do want to attend, if they email Jessica Brittles, or actually if they do it through Joe, who's on here somewhere, Joe Coughlin, we'll see if there's any seats left, because I know that it has gone down really well, and we're up to, with everybody else helping and attending, we're over 200 people, which is absolutely fantastic. But actually, we will see if we can squash anybody else in. But I know we're near the top numbers for the environment, so we're using Kettering Conference Centre on Monday.
Thank you, Julie. So really, it's a really important event, and something we've, I think, is it the first time since the pandemic we've been able to have it face to face? So, you know, I mean, I think Dave made a really important point about masks. You know, it's something we've discussed in the Council of Governors previously, but particularly for new governors, may not have realised that many of our staff have continued to work in masks, whilst I think to some extent people outside of the NHS have sort of long, you know, seem to have forgotten about COVID, to be honest, because we've been living with it now for such a while. But for staff, it has been a constant you know, area of focus to make sure we keep our patients safe. So Dave's point about recognising really how challenging that has been, and that, you know, how much of a relief it must now be to have kind of been able to step that down, albeit recognising that a risk still remains, and we need to manage that risk. So any questions that people would like to ask? So I think Dave talked about kind of our financial plan for the coming year, and the plan to break even. There was a reference to mental health ambulances, which is a great new development that if you want to hear more about it, very happy to take any questions on that. And the establishment of a new sort of a new network across, I think it's across the whole of the ICS, isn't it, Linda? Is it for Black and ethnic minority staff to connect across the ICS? Is that the update that Dave was providing? Linda, would you like to come in and say a bit more about that?
Yeah, thank you, Krishna. Unfortunately, I've lost my voice, but I'm it is for ethnic minority nurses, midwives, allied health professionals, including our healthcare support workers. So we had everyone participate: NHFT, ICB, St Andrews, the charity, as well as the two acute trusts. So really good event that we've had.
Brilliant, thank you, Linda. I won't ask you to come in again. Save your voice. Sounds like it. Otherwise, we'll make it crack. And do you want to say a bit more about mental health ambulances? Because people might be interested to know about that development, as it's still quite new.
Yeah, so the idea behind the mental health ambulances is to really support our local communities and to help give some sort of parity to mental health. Whereas usually ambulance is very focused and should be on physical trauma and how people are supported. It's about how we give that mental health input. So for the ambulances, the model is very much about working alongside EMAS, moving into the sort of support range of attending and taking over when there's a mental health and no physical trauma, and giving an environment and space to talk at the point of crisis and to be able to make a plan about what's the benefits, what would be the best thing to happen for that person, what services could come in, voluntary sector, statutory sector, where can we get the best support to support someone in the community. So it's very much in early development. We are one of the areas that has really taken this forward, but we I think it's fair to say we've got quite a, as you'd imagine, co-produced response to this with carer support workers recognising the absolute value of carers in a crisis situation, as well as peer support workers to make a very rounded approach to looking at someone's crisis situation.
Brilliant, thank you, Anne. It's so yet a really important innovation, really, to add, as Judith said, to the suite of services we can offer to our community. Richard Amponza.
Thank you, Krishni. Yeah, I just wanted to add to what Anne said, because this is a piece of work that I was involved in my previous two previous roles, I should say. So it's something that is really, really close to my heart. And I think the one big advantage of this is it helps us to reduce the pressure on our acute services. You know, somebody who's worked in clinical services and acute liaison mental health services, and we have a lot of people coming who would clog up the system in the front line, but who really don't have any physical health issues that require immediate attention and won't need mental health services. So what this does is it helps us to be able to eliminate that. Once that physical health need is ruled out, we can then take it up, and they don't need to go to A&E in either Northampton or Kettering. So it's a really, really good way to reduce the traffic to our acutes. And I just also wanted to quickly comment on David's point about NHFT having maintained the mental health investment and mentioned parity. I think mental health is something that has always traditionally suffered from a lack of parity of its team. So to hear that we maintained our investment is something that is really comforting. So thank you to the board for that work.
Thank you very much, Richard. So really good to hear your perspective. So thank you very much, Dave. I don't think there are any other questions or comments, but really helpful update. So we move on to the final topic, the final main topic on our agenda, which is to hear from one of our non-executive directors. So again, for new governors, what we normally do is agree a topic that we believe would either at your request or one that we feel it would be really important to give you some assurance on. So usually it's something we've talked about at our board meeting, but it's a really good way of bringing it to life for you as governors. And on this occasion, having recently looked at our staff survey results, which, as you can imagine, is a very, very important set of information for us about how our staff are feeling. We discussed that at our board in March and thought it was really important to share some of our perspectives about it directly with you. So Melanie Hall, who's our Senior Independent Director and a long-standing NED, and our Wellbeing Guardian and our Freedom to Speak Up lead, and a number of other things. Melanie's going to take the lead on this, but I'm sure that other NEDs will be happy to add their voices to it. And please do ask questions if you would like to. So over to you, Melanie.
Thank you. Add voices, but not in a heckling fashion, may I say?
Not in a heckling fashion, yes.
Okay. Before we delve into this slide, Tracy, just go back a second. I just want to say hello, everybody. For those of you who haven't sort of seen the results of this kind of survey before, we're hopefully going to be able to set them in context for you this afternoon and give you some insights into Northamptonshire's sort of feedback from our staff. But I thought it was important, just before we go into the results of the survey, to really emphasise that this staff survey is just one of a myriad of ways in which NHFT seek to engage with staff and listen to feedback. And from everything from sort of the individual appraisals and team meetings through to staff networks, particularly around protected characteristics, union engagement, service visits, drop-in sessions, conferences, and specific programmes maybe to gain feedback around particular issues like strategy. NEDs are continually engaged in these kind of activities and can evidence really just what a broad approach NHFT takes to staff engagement and understanding the perspectives of our workforce, what their issues and concerns are. So having said all that, the staff survey forms a particular point in time in the year. And Tracy, if you now move on, thanks. Or is it Joe? Is it you, Tracy, moving the slides, or am I? Yeah. So each autumn, the whole NHS takes part in the staff survey process. It's one of the biggest workforce surveys in the world. Everyone's invited to take part, and it gives you a moment in time against a comprehensive set of questions as to how our workforce are feeling, and it gives them the opportunity to express their views and give feedback. And one of the real benefits of this is not only does it give NHFT our own individual perspective, but it also enables us to compare ourselves to like trusts, so community and mental health organisations, but also against national pictures. And all of those results also feed up into NHS England and inform national strategy. So it's a really important piece of work. And this year, out of the 51 or so organisations that we are benchmarked against, we came out as 7th, which is a great result for us. And I hope what you're going to see is still a very strong set of results in the next few slides. But there are also challenges, of course. And one of the challenges that we experienced this year was in our response rate, which dropped for the first time in quite a while. It dropped to 46% from 55%, I think, last year. And we need to do work to understand that. And at the board, that was one of the areas that we focused on and that as NEDs we questioned as to how that understanding is going to be gathered. It just also means that at 46%, slightly less robust maybe in terms of overall perspective than a higher response rate. And in certain teams and certain services, that response rate might be a little bit lower. So we always need to look at the response rate to get a sense of how representative the results are in a particular team or service. Having said that, 46% overall is still a lot better than other organisations achieve. And we can take a lot of insight from this survey with that response rate. So if we move on to the next slide. For those of you who may not be familiar, NHS England launched a couple of years ago, the People Plan, which is the national strategy in terms of developing workforce. And a core element within that People Plan is the People Promise. And it's the People Promise and 9 promises that every NHS organisation has to deliver to its workforce are the way in which it's those 9 promises that we look at the results of the survey in those groupings. So what you'll see there are the 9 elements, the 9 clusters, if you like, of questions that the survey looks at. So what you'll see in this slide and what you'll have seen in the report is our organisation is the column, the dark blue column, for those of you who can see all the colours, the dark blue on the left-hand side, and the average for our particular cohort of benchmark trusts is the paler blue on the right-hand side. And then we have the orange line, the lower line is the worst score of any of that benchmark group. And the green line is the best score for that benchmark group. And I think the first thing to note is that we were better than average in every single element of the People Promise, which is a good position to be in. And in most instances, we are considerably better than the worst and just skimming under the best. So we are in a strong position overall as a trust against this important commitment to our people. The other important factor is that ability to benchmark also enables us as NEDs to understand the differences between us and other trusts, but also guides NHFT into where other trusts might be consulted and reached out to for good practice, for ideas, for better practice, and for other learning. And that's been something that certainly myself as a NED, I have seen over the years of this survey that I've been in this position, is NHFT taking a great outside-in learning perspective in these areas and reaching out to other trusts for best practice. So if we move on, just delving in a little bit more detail, on the right-hand side first, you'll see a comparison year on year and then against our benchmark group in those 9 different categories in particular scores. And as you can see, most of them are static. A few have gone up a little bit, a couple have gone down a little bit. But I think it's important to point out that where there is an improvement or a decline, it's a point something of a score, and that isn't statistically significant. Normally you have to get to a 0.5 difference for it to be particularly notable. So there are some minor changes, but of course, within those scores, some of those changes might help us understand something particularly important. So on the other side, on the left-hand side of the slide here, we have a couple of areas where we saw particular improvements in score, and we'll delve a little bit deeper on the next area as well. So on the next slide. So what's going well? We actually increased the population of staff who were able to participate in the survey, so that's good news. And as we said, we've had a slight increase in score for We're Always Learning and We Are a Team. And we've seen some year-on-year improvements in the scores underneath us, in some of the detailed scores in our adult children and ambulatory services and in adult mental health, learning disabilities and specialty services. So some of our service areas have seen a notable increase. And we've also had some positive scores within our corporate services as well. But of course, you know, what this survey is about is, alongside celebrating the fact that we are doing well, it's also about giving us direction and guidance as to where we need to continue to focus. So we've seen a reduction in the percentage and the absolute number of people. So that's that response rate score. The fact that fewer people responded means that we've had less people tell us how it feels to work for NHFT. And that's something we certainly want to turn around as we go into next year. And we've seen the representative of results, you know, fall below the 50% of eligible staff. So ideally, we'd want to be above 50%. 46% isn't a disaster, but we'd like to see more. And we've had that slight decrease in scores, so we are recognised and rewarded, and we each have a voice that counts. So looking at those slight changes, let's move on to the next slide, and it'll give you, alongside what's in the paper report that you've seen before today, some of the notable areas of improvement and some of the areas that we need to address. So you'll see there are some quite good and big percentage increases in some of these scores. And what you'll see there is the people promise that it refers to, and then the specific question that's asked in the survey. So for example, We Are Always Learning is the people promise, and I have opportunities to improve my knowledge and skills. And to see a real significant increase in areas of We Are Always Learning is incredibly positive, because NHFT is a learning organisation, and the development of our people in their skills and their capabilities is really important. And then we also saw some significant increases in the We Are a Team. And again, I think coming out of COVID, when we saw some real challenges to isolation and how teams were broken up by home working, different working practices, to see that We Are a Team scores come back is again very positive. And to see that cohesiveness play out as we've worked hard, and as NEDS, we've discussed at board and seen a number of strategies evolve within the trust, like flexible working, etc., that is enabled, we think, that cohesiveness to come back. But on the learning side, the areas that we seek to address, there were some quite significant declines in the We Are Recognised and Rewarded. And whilst it's important not to assume that NHFT would naturally follow wider trends, I think if you look at the national survey results and the results across the benchmarking group, this We Are Recognised and Rewarded has been a particular area of challenge for all NHF trusts. You know, and within the environment that we're currently operating in, with junior doctors, with nurses, with strikes, with large dissatisfaction on pay, cost of living pressures, and the challenges in workforce generally in terms of recruitment and in terms of sickness absence and in terms of stress, and many staff still recovering from COVID, and recovery from COVID is still, and in service visits and particular one-on-one conversations I've had in the last month as a NED, staff referencing the fact they still don't feel they've fully recovered. It is still a consistent theme. So I think in that context, maybe it's not surprising that NHFT also sees the scores in this particular part of the survey dropping a little. I think an area that we as NEDs and as the Freedom to Speak Up lead you know, we also discussed at the board and wanted to see further investigation around, and that is the plan, is around we have a voice that counts. So this isn't just referring to formal schemes like freedom to speak up, but it's also referring just to staff feeling that they have the opportunity to speak up or talk about a concern that they have in any context, and that the organisation responds. And again, it may be symptomatic of burnout and the pressure that the workforce is still under, the speed and demands still being placed on staff to cope with recovering backlog, ever increasing waiting lists. But this is still an area that will be further explored within the next steps. So if we move on, at board, we had a lot of assurance that these results, of course, will be delved into in more detail. And it's also worth emphasising, I think, that these results are discussed at many other forums to make sure that action happens, overarchingly supported by the Trust Staff Engagement Programme, which is called Let's Talk. And Let's Talk is a long-term programme. It's not a specific programme that responds to the staff survey. It's an overarching programme. So the staff survey findings feed into Let's Talk and enable Let's Talk to review its focus and refocus as required, according to what the survey is saying. And there are 3 levels of Let's Talk. Firstly, it's the overall trust approach to staff engagement, the overall trust-wide engagement. Then there will be elements of Let's Talk that focus on staff groups that have particular communication requirements, or that we want to have a particular conversation with. And then there is a level of Let's Talk and looking at the results in terms of particular services and teams, where maybe there's been poorer response rate, or there are results which air a particular concern or a particular challenge. So this programme now mobilises, and the board has the opportunity to understand, and as NEDS we have the opportunity to understand how this programme progresses. But there are other forums as well, and you know, from my perspective as a NED, these results came to the staff, to the Wellbeing Steering Group last week for a discussion about what these results show about the well-being of our staff. I know that these results are looked at closely by the Equality, Diversity and Inclusion teams and the various networks that we as NEDs attend. So I think it's important to understand, and just to emphasise, as I draw to a close, Christian, you'll be pleased to know that these results now permeate out into the organisation. As NEDs, we have, I think, a number of opportunities, both formally through the board, through the networks that we sponsor and work with, through the committees and groups that we attend, but also as NEDs, we look for assurance on how these results are understood, and maybe have the opportunity to get frontline perspectives as we now go about our continued service visit agenda. As we go out and we have the opportunity to talk to staff, we join team meetings. It's an element, it's an item of conversation that we also have the opportunity to ask staff about how they felt. So I hope that helps everyone to sort of understand at a good sort of summary level that both the results and how as NEDs we gain assurance, and how the next steps are taken forward and monitored. And now I'm looking, I can see one of my NEDs, one of my colleague NEDs already has got her hand up, Christy, so I hope she's coming in with further evidence and commentary, Julia.
Thank you very much, Melanie. I'll bring Julia in now.
Thank you, Krishni. Thank you, Melanie. Absolutely brilliant summary of all the different areas that we look at. Just to add another dimension, really, which is through the quality and safety lens. And of course, we deliver all of our services in every single part of the organisation through people. And so all the different indicators that affect how people feel and how competent they feel, whether they feel they're learning, etc., really have a direct impact on patient care, and particularly around patient outcomes. We know that from research. So we've taken a particular interest in some of the indicators over the last couple of years that I've been part of NHFT. two specific areas. One is from the freedom to speak up sort of angle, as Melanie suggested, you know, people feeling confident when something goes wrong or they see something that they feel is unsafe. People have to feel that they can share that and that action will be taken. And I know that we receive some details at Quality and Safety around that, and have the opportunity to ask questions and sort of hear assurances about actions that have been taken. And we've actually asked for specific evidence of actions on a number of issues that staff have raised. So that's another layer of assurance. And so I suppose it's just to build on it, it's viewed from many different layers, and as Melanie said, it goes through many different forums. I like that. You can never look at this too much, and as you said, Melanie, lots of other aspects of feedback from patients, from staff, that also sort of contribute to how we're delivering care. So it is an important part, and it's scrutinised really well, and we look forward to the action plans underneath it, and assure you that they are looked at in great detail, because all we want at the end of the day is to have staff who feel, you know, competent and safe and can deliver really good quality care. So thanks. Hope that helps.
Thank you, Julia. I think it's a really, really important point to recognise that the point that Julia made about the research showing really that, you know, that there's a very clear connection between how staff feel and the quality of the care that we provide to our patients and the people that we serve. So you know, the staff survey is important in its own right, but it is really important for patient care, and that's the key message, I think. Saqib.
Yeah, I was just briefly going to mention that in a different NHS organisation that I'm involved with, their results weren't as great as ours, and there were particular issues why that was, but they're now having a follow-up. And I think it's really important to know how your staff are feeling, as you said, because it does have an impact on both retention and how they deliver care to the residents and patients that they deal with.
Thank you very much, Saqib. And Joanne Dalrymple-Smith. I'm having to say your name in full, Joanne, because we've got another Jo in the room. So
too many Joannes, isn't there? Two Joannes and
never too many. Never too many.
That's right. Just to say, as a dietetic department, we've had our breakdown. We didn't have it last year, but we have had our breakdown, and we're going to be discussing it at our county-wide meeting. So I think that will be really good for everybody, for all the staff, to have a good look at the figures and see, and for people to, you know, share how they feel and get some more information about that. So just to confirm, Melanie, what you're sharing, yeah.
Thank you very much, Joanne. Really good to hear that it's you know, how it's being cascaded to make sure we're actually taking action to address these results at service level. So really helpful. Any other questions or comments? Tim Harrison?
Just on that point, I was going to say, Krishni, it's really powerful as well when people have spoken their mind about what they're saying about our service, both good and bad, that we're really clear with the response which says they said, we did. And it really can land quite powerfully when we come around to it, that, you know, you said this a year ago, this is the action we took. And it's just that real clarity of, we heard it, we took action, that we just need to really land. And that is the most powerful part of this.
Yeah, absolutely. Thank you very much, Tim. And Tim, just to make sure that everyone knows who Tim is, Tim's one of our associate non-executive directors, and actually governors helpfully were involved in recruiting Tim not that long ago, indeed, and Joanne and Robin as well. So really good to have you here as well, Tim. I think this is your second governors meeting, isn't it now?
Yeah,
so
thanks, Krishna. Yes, this.
Great. Okay, any other questions or comments? Everyone happy with the assurance they received on the staff survey? This is really, as I think Melanie emphasised, a snapshot on you know, of how our staff are feeling. There are actually opportunities through other mechanisms, including the pulse mechanism, which I think works through the course of the year to get a bit of feedback from people as well. So it is a really important thing for us to be focused on, and something as the board we take very seriously. And I'm sure you'll hear more about it as the weeks and months go on. But thank you very much, Melanie, for really kind of putting a spotlight on it for governors. So we'll close that item there. I think that we have got through our business relatively speedily and efficiently today. We're a little bit ahead of time. So I'm shortly going to bring the meeting to a close. I probably won't invite any other business. So there is a rule that if you want to raise any other business, that you should let me know at the beginning of the meeting. So I'll take it that there's nothing that needs to be raised. But I will just mention that the next board meeting of the Trust Board, which obviously includes the executive and non-executive directors, takes place on the 25th of May. And as governors, if you have the time and are so inclined, you are able to watch that board meeting take place live. You can also watch it after it's taken place. The video is normally available to watch within a week or so, and that obviously means you can flick through it and watch the bits that you're interested in. But it's certainly something we would suggest that governors should do if they'd like to understand how we operate and know a little bit more about that. So Richard has helpfully put the email address for you to contact us if you want to observe the board meeting, and the link will be sent to you along with the papers. So I'm going to bring the meeting to a close, but what I did want to just reinforce to governors, I would really appreciate it if you could come back slightly earlier than we probably said originally, but perhaps at 5 o'clock. It would be really great if you could join the link, which is called, which is the private Council of Governors link. Tracy and Joe and others would have sent that to you along with the other links. We do have some important but quite short business to conduct, and we need, in order to make some decisions in our private council meeting, we really need as many governors as possible to be there. I would hope it won't actually take us very long, probably half an hour or so. So I'd be very grateful if as many governors as possible could join that link at 5 o'clock. It is just a meeting for governors and myself and the corporate affairs team. So I look forward to seeing you at 5 o'clock. Otherwise, thank you all, everybody, for your contributions, and I look forward to seeing you at our next meeting, which will be in July, and we'll be in the summer by then. So thank you all. Bye-bye.
Thanks, Virginie. Thanks, everyone.
Thank you. Bye.
Bye all.
Everybody.
Take care, everybody.